Welcome to the genetic screening training video. Today we will discuss how to successfully intake a patient into the Electronic Health Record System, or EHR. Today we will review the intake process for CGX, cancer screening, or PGX, pharmacogenomic screening. Each intake specialist will be provided with a unique username and password, which will allow the intake specialist to enter patient data, upload required forms, and accept electronic patient signatures. The first step in creating an accurate medical record is to validate the patient by completing the intake questionnaire. Once the questionnaire is completed and the patient consent form has been signed, you should collect copies or photos of the patient's information. The best practice is to collect a copy of the front and back of the medical insurance card, which I have done here, and if possible, the front and back of the patient's driver's license or ID card. You will also need to get an image of the patient's signature off of the patient consent form. The images of the medical card and the patient's signature can be collected by taking a photo and saving them to your computer or your photo gallery. Be sure to only take a picture of the signature on the form, not the entire form. For HIPAA compliance and best practices, our EHR system has a two-step verification process, so you will be sent a text message to your mobile phone on file to validate each login. The EHR is a medical process, and data entered into the EHR becomes a permanent patient record, which has an audit liability of up to 10 years. As the patient intake specialist, it is your duty to enter complete and accurate information. Once logged into the EHR, you will click the link to the left labeled Order Request. This is where you will start a new patient record or view a previously submitted patient record. If you started a patient record previously for CGX or PGX and did not complete it, then this is where you will edit or update the medical record. If you're creating a new patient record, you will start by clicking the New button at the bottom right of the page. At this time, please note items with a red X are required fields. Items with a green check mark are not required but are considered best practices to collect. Collecting more information provides a more complete medical record and will have a better turnaround time for lab submissions. The client access code is very important and must be accurate. You should only use access codes provided by the corporate office or the medical practice. As you enter patient data, you will see the red X turns into a green check mark, indicating the field has been completed successfully. Please type in as much patient information as you can to validate the patient. If the patient does not have an email address, you can use test@test.com to get past this required field. However, if the patient has a valid email address, then it is important to use the valid email address. In this case, I have also already taken a picture of the front and back of the patient's driver's license, so I'll enter that information in the system and upload the images into the medical record. You will upload front and back separately, so make sure you create two separate files for the front and back of the ID cards. Images now appear as an attachment to the medical record. Click the Next button to proceed to the next step. The system autosaves information, so you can come back and complete a medical record later. The next step is to enter the end payer or insurance company information. Please note that as you type, the box will auto-suggest insurance company names. For CGX and PGX, we only accept certain insurance payers. We do not accept all insurance companies listed, so please only submit patients who have one of the approved insurance plans listed on your intake questionnaire. Please note that for U.S. Medicare programs, you will enter National Medicare CMS as the insurance provider. The next step is to upload the front and back of the patient's insurance card. You will also be able to enter any supplement coverages that the patient might have by scrolling down. You will see payment information on the right-hand side. Payment information is not needed for our current CGX or PGX program, so you will skip or leave this section blank. You will see a tab at the bottom named Check Eligibility. This button checks or confirms that the patient is active with the insurance provider. It does not guarantee eligibility or reimbursement for CGX or PGX screening. It is used to confirm patient data. Keep in mind the EHR system does much more than just CGX and PGX intake, so many areas of the EHR will not be used. The primary care provider section is where you will list if the patient has visited their primary care provider in the last year. To the right is where you will enter the primary care provider's information. You will enter the zip code of the doctor, then click away from the field, then a search icon will appear to the left of the green check mark. Click the search icon and the system will provide a list of medical providers in that zip code. Scroll down and select the appropriate doctor from the list. If needed, you can edit or add doctor information by clicking on the doctor record. The Products and Services section is where you select labs to be ordered. In the first field, Chief Complaint, you should type exactly what the patient is saying about their health. This section needs to be very detailed. The chief complaint is not that the person has a family history of cancer. You should ask the patient how they are feeling. A chief complaint might be, I have a constant headache and I cannot sleep at night. Next, you will select what labs need to be ordered, CGX, PGX, or both. In this demo, we will select both CGX and PGX. The sections below labeled Topicals, HRT, and Non-Emergent should always be left blank when submitting CGX or PGX lab patients. The section on the right labeled DME is not needed for CGX or PGX, so that should also be left blank. The next section, Medical Conditions, should be answered in detail. Select all the health conditions from the list that apply for both personal history as well as family history. The section to the right, Patient Vitals, are not needed for CGX or PGX, so you do not need to complete this section. Remember, the EHR is used for multiple healthcare programs like hormone replacement therapy and DME. This section, Personal Vitals, is used for validating patient orders for durable medical equipment, so it should be left blank. The patient medical history page is one of the most important pages, so please enter as much information as possible. The PGX collection section is on the left and the CGX collection section is on the right. Please note that when submitting both CGX and PGX on the same patient, the collection dates in the EHR must be at least one business day apart. You should not have the collection date as the same date. The next step is to enter as much medical information as possible. In this case, my patient is taking multiple medications that are on the PGX questionnaire. So I will enter the medications, dates, and conditions treated with that medication. Please note that you do not have to press the Add button for the information to be saved. If you press the Add button in error and need to remove that field, just click the trash can to delete the unwanted fields. You should also list any surgeries that the patient has undergone. Please note that under the surgery section, under name, you should enter the type of surgery, not the person's name. For example, you should enter hip replacement. Remember, the more information you submit, the more accurate the medical record and the sooner the lab can complete the lab order request. The section to the right is the CGX data process. Select the relationship of the person with a history of cancer and enter the type and age of cancer diagnosis. If the patient has multiple family members with a history of cancer, then click the Add button and enter the appropriate data. The next section, below the Family History section, is the Personal History of Cancer section. If the patient has a personal history of cancer, then you will enter that information as well. The Cancer History page has a list of questions that must be answered by the patient. Please read each question to the patient and have them answer the question. Please note that some questions have sub-questions that will be displayed once the yes answer is selected. It is important to answer all the sub-questions as they appear. For example, if diabetes is selected, then sub-questions of type 1 or type 2 will need to be answered. The section on the right are dynamic questions that will appear based on the patient's family history of cancer. These questions need to be read in detail and must be answered by the patient. Remember, these questions are medical in scope, and some questions can be very personal and very difficult, so please be detailed and compassionate when asking these medical questions. Remember, this is a medical program, so these type of medical questions are necessary. Read all the authorization questions as they appear to the patient and make sure the patient understands the question. These compliance questions are required to be answered before submitting a CGX or PGX lab request. The final page is the patient authorization page. It's important to collect an email address from the patient and ask the patient what is the best time to be reached by our medical provider. Also add any additional notes for the provider. For example, the patient may be hard of hearing, so request that the doctor speak louder during the consultation. The patient will also need to agree to the terms of service section. The Zoom ID section should be left blank. The section to the top right is where you will upload any supporting documents. We suggest uploading a copy of the signed patient consent form. The patient will sign by mouse, or if you have a touchscreen, they can sign using a finger or stylus. If you need to clear the signature for any reason, click the yellow clear button. In this case, I have a picture of the patient's signature from the patient consent form. Click the upload button to upload the signature image. To save the signature, click the Save Changes button next to the yellow clear button. You'll also see a Generate Summary button. This button is for doctor use only. The doctor will consult with the patient and determine medical necessity. The doctor will add patient notes using the Generate Summary button. At this time, you're almost done. Click the Save button at the bottom right and your medical record is now created. Please note that you should never click the Submit button. The Submit button is for clinical use only and is for the doctor to submit the final medical record to the lab. You should only click the Save button, never click the Submit button. If you click on the Order Request button on the left menu, you will now see the new lab order in your system. You can select the patient medical record and scroll through the pages using the tabs at the bottom to confirm that all information is correct. Congratulations, you have now saved a lab order for review. The next step is to mail the completed test kit and patient consent form back to the corporate office. Once these items are received, third-party verification will need to be completed. Thank you for watching the Genomic Screening training video.